Hello, I'm Jennifer Smith. I'm a volunteer pharmacist at MLK Health, and today we're going to talk about diabetes medications. So one of the first medications that we'll talk about is Metformin. So this is one of the most common medications that is used for patients with diabetes, and it's often one of the first medications that's started when you get diagnosed with diabetes, or even before you get actually diagnosed with diabetes. This medication has a couple different forms. There's a plain form and then there's extended release form, but most patients are on the regular form, so you're going to take it twice a day. Some of the most important things with Metformin are to make sure and take it with food. One of the major side effects of Metformin is some stomach upset, so it can make you feel a little bit nauseous and sick to your stomach. But if you take it with food, it generally is a little bit better. Also, when you start Metformin, usually we'll start you on a lower dose initially and slowly increase that dose until we get to the target dose for you that is going to work best for you, because that helps minimize those side effects, and so you don't usually have as much trouble taking that medication. One other thing to remember with Metformin is it does have some interactions if you have any kidney or liver problems. So this is something that your doctor will monitor. So make sure that you keep your follow-up appointments and get that lab work done when they ask you to, just to make sure that we are monitoring it appropriately as you're taking it, make sure it's safe as you continue the therapy. Another common group of medications that are used for patients with diabetes are the sulfonylureas. I know that's kind of a mouthful, but you may recognize some of the drug names as like glipizide or glimepiride. They're used pretty commonly with patients with diabetes. One of the most important things with these medications is they can actually cause your blood sugar to get very low, so it's really important to take it with food to make sure and minimize that risk of low blood sugar. So we don't want to cause your blood sugar to be too low, we want to just control it at an appropriate level. So since these medications can cause your blood sugar to be very low, again, it's very important to take it with food. So if you take it once a day or twice a day, depending on what's prescribed for you, make sure and take it with a meal. And usually we recommend taking it with the largest meal of the day, again, to prevent those low blood sugar levels. If you have to skip a meal or you feel you're not going to get to eat your meal at the same time as you normally would take your medication, we recommend holding that medication and taking the medication when you're able to eat, just to avoid those low blood sugar levels. Another group of medications that are sometimes used to treat patients with diabetes are the TZDs, and we use that abbreviation because it stands for a very long word called thiazidinediones. And this group of medications includes pioglitazone or Actos. So some patients benefit from the use of this medication to control their diabetes. It is again used just once a day, but we don't use it in patients who have any heart problems just because of potential interactions. Okay, another class of medications that's used are the DPP4 Inhibitors. So it's kind of a fancy name, but these medications work on a specific hormone in the body and inhibit that to help break down sugar in the body. These drugs often are called gliptins because the names end in gliptin, so it helps us remember the drug names. So some examples of these drug names are like saxagliptin, sitagliptin, linagliptin, or some of the brand names Tradjenta, Onglyza, Jardiance, or Januvia. So those are commonly used medications that you may be familiar with. These are generally taken once or twice a day, depending on the medication. So remember, always refer to your medication label to see how many times a day you need to take that medication. And the good thing about these is they don't generally cause low blood sugar, so they can be taken with or without food, whatever is easiest for you to remember for the time of day. As long as you take it around the same time each day, we work. So some side effects of the gliptins, they can cause some minor headache and sometimes respiratory problems, so like kind of an allergy reaction, like a little runny nose or upper respiratory infection symptoms. But again, those usually are minor and usually don't cause a lot of problems for patients. But if they do, please let your doctor know, because they may need to choose another medication that will work better for you. Another medication that's used to treat diabetes are the SGLT2 Inhibitors. So again, kind of this mouthful of abbreviations. But these medications have the same kind of ending, so they all end in flosin, so empagliflozin, dapagliflozin, canagliflozin. You may recognize their brand names a little more commonly as Jardiance, Farxiga, or Invokana. And these are oral medications that help block the absorption of glucose, and so you actually will get glucose that's not absorbed and it is excreted from your body in your urine. The only problem with this is one of the side effects with this medication can be more frequent urinary tract infections or vaginal infections in women. So it's something to watch out for, and make sure that if you have any symptoms of a urinary tract infection, to let your doctor know so they can check that out and get treated so that it doesn't cause any problems down the road. Otherwise, these medications, we do need to monitor some lab work to make sure that your kidneys aren't hurt or your kidneys are in good shape when you're taking this medication. So it doesn't generally cause harm to the kidneys, but if you have any reduced function in your kidneys, because that's where it works, it doesn't work as well if your kidneys aren't working as well. So we may need to adjust your therapy if your kidneys aren't working as well as they were previously on the medication. Another type of medication that's used to treat diabetes is actually an injectable medication that's not insulin. So many people are very familiar with insulin, but in the past several years we've had development of several other medications that are injectable but not insulin that help treat diabetes. And one of those categories are our GLP-1 receptor agonists. So these medications you may have heard of. Again, we have medications like exenatide, liraglutide, and these are Byetta, Bydureon, Trulicity, Victoza, Ozempic. There's a lot of different types of medications, but they're all in the same group and they all work the same way by mimicking a hormone that is in your body, and it helps your body better use insulin and break down that sugar in your body. These injections, it varies on how frequently you need to inject the medication depending on the brand of medication that you get. So they all work similarly, but some need to be injected once a day, some are twice a day, some are even just once a week that you can inject, and it helps your body over time control that blood sugar. And these are very interesting medications because they are kind of a complementary to some of our other oral medications. But it is important, if your doctor chooses this for you, they may take you off some of your oral medications and change to this because we, again, don't want to cause low blood sugar. We just want to keep your blood sugar within that goal range while you're treating it. These medications also have a benefit. They may contribute a little bit to weight loss. Again, not a huge amount, but that's often a beneficial side effect for patients. They sometimes do cause a little bit of nausea or vomiting, and they may cause some injection site irritation or redness at the site of injection, but generally it's not very bad, so patients generally don't have a huge problem with it. But again, if you were taking this medication and have any questions, concerns, definitely let your doctor know, and we'll check it out and make sure that you don't need to be switched to another medication that will work better for you. And lastly, just to be complete, many of you know that at some point, if you have diabetes, you may have to take insulin. And often patients are very scared to start taking insulin, but they, because it's a shot, they have to give themselves a shot. But it's really not that bad. We have a lot of devices now and pens that make it much, much easier than it used to be to inject insulin. And we have a lot of different types of insulin. So there are some types of insulin that are very long acting, so they work over the course of a whole day. And there are some that are shorter acting that you take maybe just with meals. And often we have to use a combination of those, again, to try to keep your blood sugar levels at an appropriate level throughout the course of the day and make sure prevent those side effects that come from not managing your blood sugar and your diabetes. Another important thing to remember about diabetes medications is it may take more than one medication to control your diabetes, and that's okay. It's actually very common because the process of how your body handles sugar is very complex, and so we may need to target different points in that process with the medications to make sure and get your blood sugar under control. So for example, Metformin, one of our most commonly used medications, works in a few different places in the body. It works in your liver, where sugar is produced sometimes, and then also in your muscle cells and helps your body better use that insulin that's available. While other medications like the SGLT2 inhibitors that we talked about, like Invokana or Farxiga, those actually decrease the amount of sugar that your kidneys keep in the body. So it increases the sugar that you're getting rid of. So again, it works in a different part of the body and a different way to help lower your blood sugar in the body. So it's very important if you're prescribed more than one medication for your diabetes that you do take all those medications as prescribed. And if you have any concerns, questions, let your provider or pharmacist know so that we can address those at your next visit. So thank you for listening. I hope this information about diabetes medications is helpful. Again, if you have any further questions, concerns, please feel free to ask your provider, your pharmacist, and we're happy to answer questions and make sure you can use your medications safely and effectively and get the most benefit from them. Thank you.